My name is Ray McLean. I live on Long Island from the state of New York, where I'm currently presenting from. Today, I will be discussing the neurobiological effects of childhood trauma and how exactly it manifests different psychiatric disorders in adulthood. The reason I chose this topic is attributed to my passion for psychology. Trauma is a prevalent part of societies around the world and a leading cause of death and disability worldwide. It is critical to understand the etiological, neurobiological, and psychological implications of trauma in order to better grasp the big picture. The ultimate goal is to better understand the trajectory of brain development in trauma victims in order to optimize quality of life in suffering individuals. This brings us to our aim for today, which is to analyze structure and pathway disruption in the emotional and behavioral part of the brain and its relation to disorders and negative symptoms. This is done using research from the past 15 years. So there are three types of trauma in particular that we will focus on, all of which are related to an attachment figure. The first is neglect, which can be characterized by failing to provide basic needs for children, such as food and clothing or love and emotional support. The next is physical abuse, which is shown by deliberate harm done to a child in the form of beating or shaking. And finally, sexual abuse, which can range anywhere from exposing a child to adult media to forcing a kid to participate in sexual activities. So as shown, each type of childhood adversity can lead to negative symptoms, particularly depression or PTSD. Physical and sexual abuse also have a significant relationship with physical health problems. The limbic system is the part of the brain that is involved with behavior and emotion. The prefrontal cortex, amygdala, hippocampus, and the HPA axis are structures and pathways in this area which are largely affected due to trauma. Let's look more in depth at each structure. To begin, the hypothalamus is a collection of nuclei responsible for activating the pathway involved with cortisol excretion. When high levels of cortisol, the stress hormone, is produced, the hypothalamus is told to stop activating the pituitary gland. Patients with trauma are found to have a blunted HPA axis, causing an imbalance of cortisol. This is responsible for many negative symptoms found in people with PTSD, such as suicidal ideation, chronic low mood, sleeping problems, and more. Next, the prefrontal cortex is the structure largely responsible for emotional regulation. Although there are a few moving parts, the orbital frontal cortex and dorsolateral frontal cortex are the focus. These regions are responsible for motivation and reward expectancy, respectively. These two areas, again, can be compromised due to stress and trauma, which causes an overall decrease in the functionality of the prefrontal cortex. The amygdala is connected with the prefrontal cortex since they are both a part of the same visual network. The amygdala is responsible for registering threats and creating a response. However, when weakened, the threat response becomes sensitive. In other words, non-threats or small threats create major responses. A specific example of this may be facial expressions, where an angry face, possibly a memory from childhood abuse, becomes a stressor in a sensitive amygdala. The hippocampus is an S-shaped structure in the brain that is most well known for its role in memory and learning. However, because it is connected to the amygdala, it also plays a role in emotion and threat responses. Because the HPA axis is blunted, the imbalanced excretion of the stress hormone is responsible for weakening the hippocampus. This is why those who suffer from trauma are also likely to have poor memory. And lastly, the thalamus is the final structure that will be discussed and is responsible for interhemispheric synchronization, which is the communication between both parts of the brain. The thalamus relays signals from the cerebral cortex and provides motivation for behaviors. Since the thalamus is connected to the hypothalamus, the structure is sensitive to stress, inducing volumetric changes. Consequences of this include lowered cognitive function, compromised memory processing, and sensitive fear recognition. So with all this in mind, the limbic system is shown to be heavily interconnected. Stress is a major player in weakening these systems, disrupting balance and causing many negative consequences, such as suicidal thoughts, anxiety, depression, and so on. Because high levels of stress are responsible for compromising brain functions, abuse can be linked to these disruptions. This is the basis for many negative symptoms, such as self-destructive thoughts and behaviors, inadequate resistance to stress, poor memory, and poor cognitive function. Many psychiatric disorders also have the ability to manifest. The ones that will be discussed are PTSD, anxiety, depression, substance abuse disorder, and borderline personality disorder. So, when one thinks of traumagenic disorders, the most obvious that comes to mind is post-traumatic stress disorder. PTSD has four major symptom clusters: intrusion, avoidance, negative alterations in cognition and mood, and alterations in arousal and reactivity. Intrusion symptoms may include traumatic flashbacks, intense emotions, and intruding thoughts. Avoidance means isolation to avoid reminders of trauma. Alterations in cognitive ability and mood are distinguished by chronicle mood, pushing blame, amnesia, and negative thoughts. Finally, problems with arousal and reactivity are portrayed by self-destruction, anger, panic, difficulty sleeping, and focusing. PTSD has neurobiological implications. Volume of the thalamus decreases in patients with PTSD, which causes cognitive function to be compromised. Heightened sensitivity in the amygdala, decreased hippocampal volume, and disrupted reward mechanism in the PFC increases anxiety and alertness, causes inadequate memory and mood regulation, as well as negatively affects levels of motivation, respectively. Anxiety is a notably common disorder, which is characterized by panic in response to non-threats or minimal threats that disrupts everyday life. Childhood trauma plays a role in increasing anxious tendencies. In particular, neglect and emotional abuse play a prominent role in developing anxiety disorders. The amygdala, as previously mentioned, to involve threat response, is disrupted in people with anxiety. The amygdala becomes more sensitive, so threats are easily perceived, inducing a greater frequency of panic. Because trauma is often responsible for a sensitive amygdala, anxiety and trauma have a statistically significant connection. Depression is another well-known disorder which has several origins. There are 6 symptom clusters of depression: sexual, cognitive, insomnia, appetite, non-interactiveness, and agitation. The most common cluster with relation to trauma is cognitive. Cognitive malfunction can include information processing. This is an increase in focus on negative aspects of life itself, which causes anhedonia. 16.2% of people worldwide have a lifetime issue of depression. Neurobiological origins of depression may be attributed to various moving parts. For one, the reward response system is blunted. This can cause chronicle mood because of insufficient levels of serotonin and dopamine, the happiness and reward hormone respectively. The monoaminergic theory proposes major depressive etiology in the disruption of serotonin, dopamine, as well as norepinephrine systems. It is safe to assume that prolonged stress may have a negative effect on the regulation of these hormones, thus creating major depressive symptoms. Substance abuse disorder is highly prevalent in the United States. Approximately 50% of people reported alcohol use, while 15% reported drug use. SAD is diagnosed when illegal or legal drugs, as well as alcohol, is abused and causes a notable health concern. The relapse rate of SAD is high at about 56.8% to 81.8%. This may be attributed to negative stigma around the disorder. For example, the misconception that those who suffer from SAD are untrustworthy or have bad morality. PTSD has a high comorbidity rate with SAD and has a bidirectional relationship. PTSD may cause SAD because negative emotions are often linked to drug use. Moreover, SAD worsens symptoms of PTSD because of its deterioration of cognitive function. Borderline personality disorder is a type of personality disorder which is characterized by abnormal behaviors or thought patterns. BPD in particular means insufficient mood regulation, low self-esteem, and an issue maintaining healthy interpersonal relationships. Moreover, 69 to 80% of people experience suicidal thoughts who suffer from this disorder. Trauma is a major factor in the development of BPD. Approximately 90% of patients with BPD also suffered from trauma. This is because trauma leads to inadequate stress regulation. Moreover, a disordered home life can internalize a negative self-perception. These unhealthy relationships with an attachment figure as a kid embed a negative self-image, which may make it difficult to keep healthy relationships in the future. So as shown here, there are various different disorders that may result from childhood trauma. This raises another important question. How do we treat it? There are 3 methods I will discuss: therapy, medication, and coping skills. Cognitive behavioral therapy is a general means of reducing symptoms of psychiatric disorders using psychoeducation. Several sessions are used to help inform patients of their symptoms and how to alleviate them. Trauma-focused cognitive therapy is similar, however less general in the sense that its largest focus is in adolescents who suffer from trauma. This type aims at reducing symptoms of PTSD, depression, and so on. Finally, eye movement desensitization reprocessing targets the senses to help process memories of childhood adversity. These memories have not been adequately handled in the brain, so appealing to visual and auditory cues can help repair the brain. SSRIs and SNRIs are two types of antidepressants that will help with internalized psychological disorders. Basically, SSRIs impact the uptake of serotonin, and SNRIs impact the reuptake of serotonin and noradrenaline, which helps with helping regulate stress response, memory, attention, so on. Coping mechanisms do not particularly require a professional to employ. There's problem-focused and emotion-focused, where problem-focused focuses on dealing with the problem itself, and emotion-focused helps with the perception of the problem. These are active, while avoidant will harm those who participate in it. It could be isolation, and this will worsen symptoms of psychiatric disorders. So, traumatic experience is difficult to tough through. However, the consequences are not limited to just the experience. The issue of trauma is undeniably prevalent. About 1 billion children worldwide have experienced at least one traumatic event. When we pay attention to the target region of the brain that is most affected by these high levels of stress, optimized treatment options can be developed. Learning about treatment options in your area, in the form of therapy or medication, is critical in creating a path for healing. That's all I have. Thank you for attending.
Amazing job, Ray. Great presentation. I have one question for you. Throughout your research, was there anything specific that really surprised you to learn more about?
Well, when I first picked it up, there was one of the earliest statistics I found was that 1 billion children worldwide have experienced a traumatic event, which I did not realize how prevalent that is. I did not think that the statistic was that high. So it really showed how important this kind of research is.
Absolutely. That is shocking.